Okay, so good afternoon.
Hello.
It looks like we are actually live. My name is Adoranka Batamosi Wilson, and I'm the director for the Government of Bermuda's Department of Communications. Thank you both for joining me in today's conversation on COVID-19 in Bermuda. And we have Dr. Cheryl Ball, who's the Chief Medical Officer for the Bermuda Ministry of Health, and Dr. Michael Ashton, Chief of Medicine for Bermuda's Hospitals Board. Welcome to you both. Good afternoon.
Thank you.
Good afternoon.
Glad to be here.
Thanks.
Now, I'll just ask you let's start with a brief overview of your jobs as it has been redefined by this COVID-19 pandemic. Dr. Ball, would you like to go first?
Sure. Redefined is a good word because previously I had four fairly well-described areas: healthcare, registration and regulation of healthcare professionals, particularly physicians, control of prescription drugs coming into the island and overseeing that process, epidemiology and surveillance, and some statutory functions that relate to being on various committees and giving advisory input to various government departments. But now everything is about epidemiology and surveillance, and everyone has learned how to say those words because that has really taken over what we're doing in the Ministry of Health. And that is really looking at the island in terms of how it's being impacted by this disease, by the pandemic of COVID-19, and responding to it appropriately and keeping accurate records and statistics about what's happening. So that really is the 99% of what I do, and the other things that I used to do now fall into about 1% of the time that I spend working.
And Dr. Ball, I'm going to come back to you on how Bermuda is doing, but I do want Dr. Ashton to answer the question about how your job has been defined or redefined by the COVID-19 pandemic.
Yeah, I mean, I think that it's been a little bit surreal for us. But for me, I would say that I've approached it much in the same way as I would approach other infectious diseases, being a practicing physician in infectious diseases. For a lot of us in this field, this was something that we expected at some point might happen. We've had plans in place, but it's now a matter of putting these things into action. So a very large part of my time is now spent focusing on COVID-19 response. But I have to point out that there's still a lot of non-COVID-19 work that has to be done. And there's patients that still need care for other reasons. We didn't start off as the most healthy population to begin with. So it's been a challenge balancing both of those responsibilities. Fortunately, I have an amazing team to work with, and that's really been enjoyable, especially during some of the more difficult times.
Thank you both. So let's look at what Bermuda's doing. What has Bermuda been doing well over these last 3 or 4 months since the world has learned about COVID-19 and we're currently going through this pandemic? Dr. Ball, do you want to start? Sorry.
Sure. Well, I think we've done very well so far. I'm very heartened by the level of collaboration that we've been able to establish immediately from the end of January. The stakeholders that we brought on board to help us troubleshoot the situation and plan and make a strategy for how to deal with it. And that collaboration, I would say, is perhaps our greatest strength. The way that we have collaborated, and that really speaks to the teams that we all work on, and also the community of Bermuda, of the healthcare professionals and the community itself. And I would say that we have done well, because with 144 cases in holding, 500 odd cases tests done yesterday, and no positives, we have shown that our reproductive number is under 1. So by the usual standards of assessing outbreak control, we have done well. But we are just at what a colleague called in the eye of the storm. And so we really, while we pat ourselves on the back, we absolutely have to regroup and prepare for this next phase, which is going to be even in many ways more challenging than the phase that we just have left, which was the containment phase We are going to have to learn how to make this sustainable and long-term. And so we do have a difficult future ahead, but I think we've done very well, and we really should commend our colleagues and the Bermuda community for being cooperative with following public health measures and social measures to control what could have been an out of control outbreak.
Thank you, Dr. Ashton.
Yeah, I agree with Cheryl on this. We're in a very good position right now, as good as we could expect to be. And that's factoring in that this is a highly contagious and deadly disease without a proven cure. Short of eradicating the virus from the island, which was not considered a realistic goal, we've done remarkably well. We've flattened the curve, and we now have only sporadic cases. But we have to be clear that the virus is still on the island, and neighboring countries also still have the virus and very much are in the throes of the pandemic. We also still have a highly susceptible population with probably, because of our success, little exposure to the virus. I wanted to touch just briefly upon the strategy that I think we've taken that has been extremely effective, and I describe it as a triple strategy. The first of that is that we had a lockdown and travel quarantine. The second was that we had distancing, masking, and hand washing. And then the third was testing, tracing, and targeting for case isolation and quarantine of contacts. We also leveraged our geographic isolation into a strength, and that's in spite of us being at the end of the supply chain. But what's clear now at this point is that our economy cannot sustain a continued quarantine or further lockdowns. And so I wanted to jump, because we've got limited time, really to a critical message that I want to get across, which is that until we have a cure or a vaccine or herd immunity or all of the above, we've got to up our game now with a dual strategy because we can't rely on lockdown and travel quarantines for economic reasons. We have to do even better with the other two strategies. So that's the distancing, the masking, hand washing, and then the second part, which is at the public health end, the testing, tracing, and targeting for case isolation and quarantine of contacts. This is how we bring our country's economy back and thrive as a community. And I would call it a national sort of commitment where we have to rise and make that commitment to each other that we do this. Because if we fail, the alternative reality that the virus presents is an unhappy one of both economic turmoil and rampant disease.
Okay, well, I know you touched on contact tracing. Who would like to talk about that? What exactly is involved with contact tracing?
I could talk about that a bit, but I would like to just say behind what Michael said, that it is so important for people to understand their role in the future weeks that we have before us in making sure that we don't go from this very good standing of having an outbreak under control to a very different picture where our health system could be overcome. And there is a huge role for personal action here. And Michael talked about that. That is these personal measures that we have to assure we don't lose sight of. So my key message today is that there is really power in the personal measures that individuals can take to keep this outbreak under control. It is not something that is left to the professionals, that each of us has to comply with the good advice about facial mask wearing when out in public, hand hygiene, and particularly physical distancing, because that is the crux of why we've been able to achieve what we've achieved. So moving forward, we are back in our usual social circles and starting to perhaps become complacent about those personal measures, perhaps minimizing the importance of physical distancing. And that's where contact tracing comes into play, because first of all, if we're not physical distancing, we are then more likely to be able to transmit the virus person to person. And when that happens, it's important for individuals to know who they've been with and who they've been around. But obviously in public health, what we're trying to stress is that you can prevent the need for contact tracing by not getting infected, and you can prevent the infection by breaking the chain of transmission by staying physically apart from individuals. So that 6-foot distance of physical distancing is so crucial to remember as we start to socialize and to get back to some routine activities. That's crucial. But when that fails, or when there has been less than optimal hygiene and an infection from one individual has transmitted to another individual, contact tracing means that you first hopefully identify that yourself as an infected individual quickly by monitoring your symptoms and being aware when you should reach out for some health advice from your physician. Once you're tested and identified as an individual who's infected, you're then isolated. That's a very big step, that early detection of being infected and then being put in isolation so that your household contacts and others, work or school or any other social settings you might otherwise go to, are not affected. But the contact tracing process involves a conversation, very important conversation with a nurse or other healthcare professionals who've been trained to ask questions about where the individual who's affected has been in the preceding first 24 hours, 48 hours, and then as far back as 14 days if possible, because the incubation period for this virus is up to 14 days, although usually it's the first 5 days that are most critical. So contact tracing involves knowing where you've been and who you might have been around, especially in close proximity, within a few feet from another individual for 15 minutes or so. Not so much who you've walked past in the street, but who you've been physically near in the preceding days of an infection being identified. And then those individuals are reached out to. And so there is a level of trust that has to be built between the healthcare professional asking the questions about contact tracing and the individual affected, so that there is an understanding that this is very confidential conversation, that honesty is relied upon, and that every effort is made to keep information private, but that it is in the best interest of individuals who might have been contacts, and also for the wider society, for people who are cases of COVID-19 to share openly and honestly their list of contacts with the person contact tracing, so that those individuals can then be reached out to and tested and quarantined if they are deemed to have had a significant exposure with the individual. They are deemed to be potentially infectious at some point, and so they are asked to separate themselves as well. So you'll see the continuing theme of physical distancing being key to containing an infection that's identified, and certainly being aware of where you have been. And part of what we're doing to make contact tracing easier is encouraging people to download apps that help them be reminded of where they've been. Safe Paths is being piloted at the moment for that. And there are other apps that help remind you of your whereabouts. But also it's important to limit your social activity at this point. We are not back to normal. We cannot be doing and expecting to do the things and interacting with the numbers of people that we did prior to this, the outbreak being on the shores of Bermuda. So we really do need to meet the situation halfway by not having as many contacts, not being quite as social, and certainly keeping our physical distance so we don't have as many people to contact if we become positive.
So I'm cognizant of our time. It's quarter past 2 right now in Bermuda. Dr. Ashton, did you want to add anything to that briefly?
Yeah, thanks. I'll just mention briefly that was an excellent description of contact tracing by Cheryl. And it highlights an important point that effective contact tracing relies on self-report and trust. And often I'll see that there are concerns or confusion about why it is that we might not be sharing specific numbers or names. And the reason for that is really that might compromise the trust of individuals to come forth and feel as though they can share sensitive information. And it's critical that people have the ability to be able to do that confidently and in confidence. And it's not just for COVID-19, but it's for so many other infectious diseases. So sometimes it's hard to understand, but that's one of the main reasons why sometimes the details cannot be shared.
Well, thank you both for that answer. And I'm going to some of our Facebook Live questions that have come in since we've been on the call, and a few that came in earlier. Which treatments and medicines are working?
Well, it continues to be, sorry, I'll take that one, Cheryl.
Yes, of course.
It continues to be supportive therapy. There is a lot of excitement in the last 48 hours about dexamethasone or Decadron. I think that is exciting information because certainly that is a medication that we have used in certain situations for critical care patients. And in fact, it's a medicine that we do have at the hospital, and we use it from time to time. It makes a lot of sense from a physiological standpoint because the cytokine storm might be amenable to steroid therapy. The concern, of course, also is that it could suppress the immune system. And so this is interesting and exciting preliminary information, but it still needs to go through the rigors of peer review. And, I often say to colleagues and students that you have to wait until there's a real consensus in the literature to be able to truly trust it. We may not have the luxury of waiting too long. And certainly this supports that concept. Other medications that have been considered are remdesivir, which we are aiming to procure right now. I think we might have a source through Bangladesh. That, I think, has a more limited effect from what we understand based on the trials that have been done, mostly in terms of reducing the duration of illness, but that's still really important. And then I've mentioned previously convalescent plasma as a potential therapy. It will be important to pick the right patients for that to likely have a benefit. Aside from that, most other therapies I think are still being explored. The exciting thing here is that there's a lot of research being done, a lot of activity. The one caution is just that a lot of the articles that are being circulated in the media will have not gone through a peer review process. So we just have to keep that in mind.
Thank you. Did you want to add anything, Dr. Peekball?
Michael's mention of peer review makes me want to add that the scientific process can't be abandoned in this state of emergency that we're in. It is so important for us to have a level of faith in the systematic and non-conflict conflict of interest assessment of treatment, and believe in that and have some patience for those kinds of scientific consensus studies to bear fruit, so that we don't jump to conclusions and shortchange ourselves. It's important to hold tight to the principles of the scientific investigation process. And so I say that as people read all kinds of things online, all kinds of miracle cures and possible solutions, but to hold them to the test of peer review and to look for a scientific community consensus around certain things. I think it's important for people to be reminded of that.
Okay, so our next question, any updates on the possibility of catching it twice or how long immunity may last?
There's a lot of research around that immunity question, especially as there's been quite attention given to antibody tests. And so it's important to understand that when you're exposed to a pathogen, something that's foreign to your immune system, you naturally create antibodies against it. However, the implications of those antibodies cannot be assumed. The proof has to come in helping us to understand whether the presence of antibodies means anything more than that you've been exposed. And we're hoping that it means that immunity is building, and we hope that that immunity will be long lasting. as it is with some other infections, but we just don't know, and only time will tell. And so that's why those antibody tests, for instance, are being used more for research and understanding of the process of building immunity than for actually giving people individual clinical advice and public health advice. So the question about whether you can be reinfected and whether or not your immunity is long lasting, it has not been answered, but hopefully with robust scientific study, we will get some answers to that in the months ahead.
Okay, thank you. Dr. Ashton, any other thoughts on that?
No, I agree with Cheryl on this, is that we still need to learn more. And as frustrating as it is, only time is really going to allow us to do that. Because it is a novel virus, we don't know the duration of immunity. We presume that because individuals do mostly recover, that there is a form of immunity that is generated, but how long-lasting and sustainable that is unclear. And we do know that other coronaviruses continue to infect the population as they perhaps drift in terms of their genetic makeup, and also as the immunity wanes for each individual. One important concept is just that each individual's immune system is a little bit different. So it will be important also to realize that there will be generalizations that can be made, but specific individuals with different immune systems, many of which have immune compromise, that is much more common these days because of our transplant medicine, for example, they're going to have a different interaction with this virus. And so they may be more susceptible to recurrence or reinfection.
And so you've mentioned the coronavirus. So the next question and the antibodies, this from Facebook. I would like to know if the antibody test is being offered in Bermuda identifies only COVID-19 antibodies, or does it pick up coronavirus antibodies, including from other flu viruses?
I can take a stab at that, and I'm sure Cheryl has some thoughts too. That was, of course, the first question that we had to ask the lab was, how do you know that this antibody test is going to be specific for this novel coronavirus and not cross-react with all of the other 4 commonly circulating coronaviruses? And that is a problem that all of these antibody tests will have to tackle. It has gone through a validation process so that it has reasonable specificity. We also believe that it has reasonable sensitivity, but that will continue to be a concern that we're going to need to monitor and see if indeed the results are reliable. So again, this is why we have asked for ethics review and guidance in Bermuda. We do have antibody testing through MDL, as I understand. But again, it's for epidemiologic purposes at this point and not for diagnostic purposes for all of the reasons above.
Yeah, and I would just add to that these tests, all of them actually that are available, are mostly authorized for emergency use in the jurisdiction that they have been given this this commercial availability. And it is because we don't have all of the answers worked out with regard to specificity and the sensitivity, so that it is in this setting of emergency need to understand what the level of exposure is for the community, that the antibody test that is at MDL, the government laboratory, is being utilized just to get a sense of how many of us have been exposed to the virus in the first place. But what we make of that, we will have to understand in months to come.
Okay. Dr. Ashton, you want to add a final thought?
Yeah, Adoranka, I just, it made me think also that this might be a good time, since we're on the topic of testing, to talk also about an exciting area that we're exploring, which is point of care rapid turnaround tests. And I do think that this may be a way forward, especially for the hospital, in terms of opening up our ORs to elective surgeries, and also minimizing our usage of PPEs where possible. What this test is a it's actually an antigen test that is slightly less sensitive than a PCR. PCR will always be the gold standard, that and culture would be unsafe to do. But antigen testing has the ability to be done in a more expedited fashion. Its limitation is really in its sensitivity, so it will miss some cases of COVID. However, if you leverage our current low prevalence on the island, I believe that this can be a safe approach for us by managing that risk. I think that we can use this test. There may be other tests that become available. I've asked for our lab at the hospital to explore this, and I know also Dr. Weldon and others are exploring this option, and I'm quite excited about it, and more to come on that, I think.
All right, and so I do want to get this quick question in. And I think some younger women may be asking this question. Should I wait until COVID is over to get pregnant?
Oh my. Now that's a difficult question. I can only say that it requires one's own desire to do a risk assessment. How much uncertainty are you willing to live with? And I would say that also the evidence does show that pregnancy has not shown itself to be highly high risk for COVID. The individuals who do poorly with COVID infection have not been pregnant women. But frankly, there are many aspects of pregnancy other than the medical aspects, the social aspects, the visitation, the choice in labor experience, all of that plays into this. And I think when women are making decisions about people making decisions about their lives, health matters are important, but there are these other social factors that we can't predict in this current situation. But these are very personal decisions, and I wouldn't begin to suggest to anyone what they should do.
All right.
I'll just add that we have had extensive discussions with our maternity ward and OB-GYN professionals, and we have worked out a plan for COVID. Obviously, we've now had a few months of experience, and so I would say that the risk is there, but it is a manageable risk, at least in terms of care in the hospital.
All right, thank you. Thank you both for your answers to that question. Another question, I'm cognizant of our time. If you're both in agreement, I'd like to extend our time just by a few more minutes so to ensure that we do get some more questions in from the Facebook feed. So here's another question is, any idea on when shielded people can resume normal activities?
Yeah, I mean, I would say that the finish that happens at the finish line, unfortunately, at least from my perspective, and I'd be interested in Cheryl's opinion on this. But until you have a cure, or you have a vaccine, or you have herd immunity, or any combination of those, unfortunately, shielding is going to be a necessary part of our strategy.
And I'd add to that. The question allows us to look at where we are in this epidemic, and that is we are not at the end. We are really at the beginning, because as we open up to tourism and have more visitors and to travel, have more visitors coming to the island, and we ourselves are traveling, there will be reintroduction, and Bermuda will have to manage that. And therefore, we are not in a place where we can say, we are safe and this is the end of the story. And so, as Michael said, this is not the finish line. We have shown our capacity to deal with limited introduction of cases, and now we have to show that we can scale up and make this sustainable, managing a constant flow of people in and out of the island. And that is the challenge before us. And that's why I go back to this physical measures matter, because it's so important for us to realize our own individual responsibility and our collective responsibility as a community, and holding tight to those basic principles of infection prevention and control, of physical distancing, hand hygiene, and certainly being mindful of our well-being, so that if we become unwell, we immediately isolate ourselves and seek advice from a medical professional who can determine whether we need to be tested and how we need to be managed. So it's going to be these individual commitment to keeping the island safe and keeping ourselves safe that's going to make the difference and help get us closer to the finish line, when we can go back to what used to be life as we knew it.
Thank you. Dr. Ashton, anything to add?
Only just that a lot of people on their minds would be concerned about the economy. I think that is the challenge that we are presented here, is that we have to balance public health with the economy. And I would just urge folks to realize that good public health is good business. And for example, if we are a healthy population, we will have a good tourism product, for example. We will have a business sector that can conduct business. The foundation of any business is going to still be good public health. And so they are not necessarily competing with each other if you look at it as that larger perspective.
Excellent, thank you. So another question we have is, it seems as though hypertension, kidney disease, and diabetics are at a higher risk compared to asthmatics and COPD sufferers. Have you found this to be the case?
Yes, that's correct. Actually, it's counter to what we might have expected with a typical viral pneumonia or viral sepsis that is transmitted through the respiratory tract. For example, influenza. If you have COPD or you have other respiratory conditions, you're going to be at a higher risk. What is interesting and unique about this virus is that it seems to be a vascular disease. So in combination with inflammation of the endothelium, the lining of the blood vessels, this virus seems to have an impact on kidney function. If you have pre-existing inflammation of the blood vessels, then I think that you're going to be at a higher risk. And we're still understanding a little bit more what the implications are of that. One obvious one that we're managing in the hospital is the predisposition to clots. So there's a very low threshold now to anticoagulate individuals, because if there's inflammation in blood vessels, then clots are more likely. But it does point out that our population is at particularly high risk. We're an older population than a lot of the other countries, island countries to the south, and we have a higher burden of renal disease than a lot of these countries. So the risk is higher for our population.
Okay, thank you. Dr. Peekball, anything you want to add?
Well, I could quickly say that Michael's mention of how our comparison to other countries is quite interesting. And I know that there had been a question about how Bermuda has compared to other small island states. And you can't compare apples and oranges just for that reason, because the demographic makeup of Bermuda is unique. We do have a disproportionate number of our population in the older age range, and also our chronic disease burden is fairly significant, including our burden for overweight and obesity. So that these comparisons, inter-country comparisons, are not always accurate, but the reality and the information I think I take from all of these comparison discussions is that Bermuda definitely is vulnerable because of our demographic makeup. And it is important for us to get this right in terms of preventing the spread.
Okay, thank you both. And let's go with one more question before I go to our final question. And this one, again, from our Facebook viewers. WHO is now treating patients with steroids. Is Bermuda going to look into this?
Yeah, that's pretty much the same question as before about dexamethasone. Dexamethasone is a steroid. So it's exciting for a lot of us. again, we have for certain patients been using steroids, but this now puts more weight on its use. And I think as long as we can be convinced that the evidence is in support of it, then that will likely become one of the tools that we can use. The downside, again, is just that steroids can also suppress the immune system. I suspect that it will come down to the timing of the steroid use. And like many of these interventions, you'll have to pick the right patient at the right time for it to have the real benefit.
All right, thank you. Dr. Peekball, anything you want to add to that?
Yeah, one of the things that I think we have done really well in Bermuda is picking up on the global information that is available, and not only being aware of it, because there has been an enormous amount of sharing between countries and between our public health advisors with us, but also getting access to the products that may be helpful. So getting supplies, and as Michael mentioned at the beginning, we're at the end of the supply chain as this tiny little nation, and yet Bermuda has managed to get testing supplies and has managed to get medications in the past that we thought might be helpful, and certainly I would imagine that going forward, even with remdesivir, as it is an investigational medication, we will be successful in acquiring that. And I think Bermuda has shown itself quite nimble with negotiating with suppliers overseas and using our contacts with Public Health England and Pan American Health Organization to make sure we get what is needed on the island in a prompt fashion.
Okay, Dr. Ashton,
I just wanted to share that I often have conversations with my colleagues in infectious diseases overseas, and we truly are excelling at this point, thanks to the leadership on the island when it comes to testing. I was chatting with a colleague in Connecticut, and frankly, we have more access to self-referred testing and physician-referred testing that's validated than they do, and our turnaround time is faster. And that's little old Bermuda here in the middle of the Atlantic. So, you know, kudos to everyone for that. That's an important part. Testing is not the only answer. But it's an important component of it. And similarly, you know, we've had feedback from Johns Hopkins and other institutions who have offered their assistance, Brigham and Women's as well, and all, I think, in good faith and as part of a collegial atmosphere. And I think in general, our policies and procedures have shown themselves to be at the cutting edge.
Indeed. Thank you both. And so, as we wrap up, and this has been a really enlightening discussion, so thank you both for your time and for sharing your knowledge and expertise. And so my closing question for both of you is, what are your closing thoughts for those who are watching? Any final recommendations or comments that you'd like to share?
I don't want to reiterate the personal measures message, so I'm going to choose something else, which is I think it's important for us to realize Bermuda has the potential to be a model of a community that has distinguished itself in terms of compliance to public health measures and social measures. And I'm really hopeful that we will take this as an opportunity to distinguish ourselves and that we are, unlike some communities that don't have the self-discipline perhaps to have social measures in place and to stick with our physical distancing and our hand hygiene, I hope that little Bermuda will show that it actually has kind of grasped the power of these very simple personal measures, and that as we get back to our usual activities to a greater degree, we can really still mitigate the impact of the virus because we are doing so well with physical distancing, hand washing, and wearing our face masks. So that is my hope, and it's an aspiration that I put out there to the universe, hoping that people will take it up and make it happen.
Thank you. Thank you, Dr. Peekball. Dr. Ashton?
Yeah, ever since the observations of Semmelweis in infection control, hand hygiene continues to be the core of preventing infection. And it's true for COVID-19, and throw in also the masking and the distancing. I can't help but say that is my ending point, but I'll just take a little different angle on it and just point out that sometimes we're not even aware that we're not adhering to it. It's just we're human nature for us not to necessarily adhere 100% of the time. And in the hospital, we often have to take the approach of saying that it's a good skill to be able to give feedback to a friend or a family member and say, by the way, we're not really socially distancing right now, or I noticed that you didn't wash your hands. And we try to share that skill with our healthcare workers in a way that doesn't come across as being offensive, because it doesn't have to be. And instead it can be a sign of caring, and it can be a sign of fellowship, and pointing out that we're all in this together for the success of our country.
Well, thank you. And on those notes, I'd like to say thank you to both of you for your time. And and thank you to those who have watched us on Facebook Live to send in their questions. We try to answer as many questions as we could. And if I may put in a plug that if you're willing, we'll try and do this again sometime in the near future. So thank you both for your time.
Thank you, Adoranka. It was a pleasure.
All right.
Bye and namaste.